viewers, and welcome to another episode of Health Link, brought to you in the studios of QTV by myself, your host Dr. Shamila Jah, and my co-host Maria Masane. It's really a pleasure for me to be here back in the studio again to bring you a topic today, which it's not COVID, so because everybody is calling me the COVID doctor. So today we are not going to talk about COVID, but we are here to talk about a very important, actually, a condition, a disease, which is actually, if you really look at it, it may even be, it may cause even more devastation, more deaths, and it happens at a much higher incidence than even COVID itself. We are here to talk about cancer, and specifically breast cancer. Cancer has caused in 2018 9.6 million deaths worldwide, and it is the second leading cause of death in worldwide, so even in developing countries as well. So it is a really important condition. And even COVID has actually highlighted the cancer, because cancer is one of the risk factors that gives you severe forms of COVID-19, and also if you have cancer, you are more likely also to succumb to COVID-19. Actually, during this pandemic, there have been excess deaths due to cancer because of COVID. And the amount of excess death that has happened, the estimate is that it could be 10,000 or even more, but really the numbers could even be much more than that. So it is very important that we really discuss about cancer and its importance, and what we can do to really, one, prevent it, secondly to detect it, and see what is the options available for it. So really the big C is not COVID, it's cancer. So we are happy here. We have in the studio with us a guest, whom I will introduce to you after my co-host Maria Masane has also introduced what we are going to talk about to our Wolof and Mandinka viewers. Mariama.
Assalamu alaikum badin Gambian kul aning juwirlal mbal konton na kabo QTV telebumbato kafali ko aldima Maria Masane aning Dr. Shamila Jah bi wolle nata siyale jang purukal jata kende akachakale kafomi health link aketa famoti bari mbal konton na adlala mo nyima ana la jibir nyima fanang bidung nakachata kala COVID-19 ti bari nyi wati tambilal be kachaketa COVID-19 lati pomol ka fate COVID doctor bari bidu nakachanya te tilina wala mbe kacha min kala bi wala kansati kum mayata bakale ka to ko ngaji ka mukura nete miyalon ko aka mo jama fale adunga aka mo jama ni yotale oto wala tin ngamiro ka kum maya batale bi purunga kacha mol salon ko manke COVID dorone ko mol fa bari ninga tare kansa fanon soto isa COVID jaw ma sotale COVID ay sifal sotale miyalon ko mote batala bari dol bije ninga tare kansa soto doron ase batandino le foysa foyni yola Dr. Shamila ya fanya minga ko coming 2018 mo kononto million kononto nin talante kansa e wala fa dunia mo be kono oto ngaji ka kumma batele pour mol sa lonko kansa mo kulati mi lonka jarta ka calale kumma yata nyami adu mol se minke no ki fongo tanka adu ninga tarafana ya so to isi fongo mako ino nyamin. Assalamu alaikum mbokki Gambiani ak setan kati ñu ngi leen nuyu fi tay ci QTV di leen wax ne sen dom Maria Masane ak Dr. Shamila Jah ñoo fi tok di leen waxtanal sen yefi wërgu yaram ci programme Health Link bi tay nak suñu waxtaan du jublu ci COVID-19 tay li ñoo waxtaane mooy yëfi cancer. Dinañ leen wax lan mooy cancer ak lu tax cancer dafa am solo trop pour ñu waxtaanee ko nekkul Covid rek a di reye cancer tamit dafa nekk feebar boo xam ne bu fekkee ne jógoon niñ si war a jógee dina mun a rey nit ba mu ëpp am COVID-19 comme nu ko Dr. Shamila waxee rek mu ne 2018 9.6 million nit la rey si àdduna bi yëpp kon cancer loo xam ne la dafa am solo trop pour ñu waxtaanee ko ñu ngi fi am gan tey waaye balaa may wax dara dinaa delloo waxtaan bi Dr. Shamila pour ñu wax leen ban gan lañ fi am ak waxtaan bi nu moo demee Dr. Shamila.
Thank you so much, Mariama. So our guest here today is someone that is really important in this fight that we have against cancer in the country. He is Dr. Charles Roberts, and we are really privileged to have him. In addition to what he does which is his specialty. He will introduce himself as well. But I just want to say also, in the national response, he is the COVID-19 case management team pillar head. So he has also a very important role in COVID-19 as well. You're most welcome, Dr. Roberts. Can you please tell us a little bit more about what you do in relation to cancer?
Thank you very much, Dr. Shamila and Mariama. I am Dr. Charles Roberts. I'm a consultant general surgeon at the Edward Francis Small Teaching Hospital, and I'm also the Deputy Chief Medical Director of the hospital. I'm a surgeon, so I deal with mostly breast cancers when we talk about cancers. So first of all, I want to start with maybe what is cancer.
Yes.
Cancer is a group of diseases that are caused by an abnormal growth of cells, and these abnormal growth of cells tend to spread to various parts of the body, and that is what makes it very deadly. But when we come to breast cancer, it is very important to note that when it is caught early, it can be contained. But when it's late, then we just try to do what we call palliative care. I don't want to go before the gun, so yes. I'll hand over back to Dr. Jah.
Thank you very much, Dr. Roberts. I think that's a brief introduction. By the way, viewers, we will be opening the lines, so get prepared with your questions. But before we go further, I will hand over to Mariama to help translate what Dr. Charles Roberts has just said to us about what cancer is.
Baringol na luntango kami nga file nyame nga luntan baso robi mi ya lonko e ka file Dr. Charles Roberts temu surgeon oleti molam operation mini ka mol operator banjul lopitani bato ay place bale maraje adunga ko kami teka mol operate le mini ya lonko ni ko operation o doronga ka mol je le mini ya lonko cancer mi ka file breast cancer wala cancer min ko sunjo muta woto anata fo mole munam cancer ti ko cancer mu kuranne ti mi ya lonko ninga tara bricol mini nyanta ka tara balu kono imang wulu nyanta ka wulu nyaming woto wala tinna comme ye bricol londi jan nene ka misal falie comme ninga tare bricol londi mal londi ku dorong ku ketala ning a katita dorong woto kansa mu waliti a wobriki malle ka wulu balu kono adu ni wulu ta dorong ning atara janjanta a manke kurante mi alon ko yaajo juna ase mo fanole bar ning atara jeta juna dorong fanang mi mari sekende a sottonole woto aka foko fanan ko comme bokay li docteur li suñ gan bi wax rek comme niñ leen ko waxe am nañ fi gan boo xam ne gan bu mag la ñu ne ñu ko wax Dr. Charles Roberts moom surgeon la biiri lopitaani Banjul te am na fa place bu mag liñ ko laaj mooy lan mooy cancer mu ne cancer feebar la boo xam ne comme cells ni ko anglais di waxee comme man dinaa leen liimal ne comme brique boo xam ne mu ngi war a nekk ci yaram bi mu war a taxaw comme nga war a sampuloo brique bi comme ni nga ko war a sampee full brique bi cat bi dama noonu rek comme soo ko liim noonu la mel cancer noonu la mel si yaram bi cells yoo xam ne dañ war a jur te juruñ niñ war a juri loolu kon feebar boo xam ne la boobu su amee si biir yaram bi rek fekkee ne teel nañ koo yëg mu ne am na faj waaye buñ ko teelutee yëg nag maanaam duñ la mën a defaral dara lu bari kon si gàttal soo ne cancer rek lii lay cancer. Dr. Shamila.
Thank you very much. Dr. Roberts, we know October is breast cancer month. What is the burden of breast cancer in the Gambia?
Breast cancer in the Gambia, it's actually quite common, and I believe it's even commoner than we see in the hospital.
Wow.
Because when you talk about the breast, the women tend to hide pathologies of the breast.
Sure.
They don't tend to come out quickly.
True.
Until it's very bad and they cannot hide it from anyone else. So they tend to hide their breasts. Even if they come to the hospital for something else, they don't want to tell the doctor about anything happening in their breast. So although apart from that, we still see a lot of breast cancer cases in the hospital. And I cannot give you the figures offhand like that, but every week at least we see a new case of breast cancer in the hospital. So the burden is quite high.
Quite high. So it's just like what is happening in the rest of the world, because breast cancer and cervical cancer, especially in developing countries, they are the topmost cancers, female cancers that we have. And the rates are increasing because now women are living longer, and also the lifestyle that we are now adopting is more towards the Western lifestyle, with more of refined foods and a lot of fat and obesity, stressful. So all of these things, I think they can contribute, isn't it, to cancers?
Exactly.
Okay.
Cancers, a lot of cancers, we don't really know what causes them.
Okay.
But they're what we call risk factors that are associated. And for breast cancer, obesity is a risk factor.
Risk factor, okay.
Obesity meaning you're overweight.
Overweight.
Yeah.
Okay.
So there's a way you measure obesity with the BMI, but being overweight is a risk factor.
It's a risk factor.
Yeah.
Okay. Okay. So that's a very modifiable risk factor.
Exactly.
Yeah. That's very good to know.
Badihol, Dr. Roberts coming for tendorong anyinka coming munduno leve cancer kang banko musul kang ayatandi ko coming ako musul kata lopitande bari jamawo jamake ibuka for Dr. William Bekiri wala ise malufang ka fo ko mimbela adunga ko mu kulati melon ka siata banko kanne ako coming ata fola ata nanka mo fola no ika mojeleje lokun kono mise cancer soto bara ko asafo ko lokun wasake tili wotili ay se mo fula wala mi alon ko ay cancer sotale Dr. Shamila ya nyinin kamin na tendoronga kay coming sign na balwol be nyamin sign nga nyati ling domorol la mini la lon ke be poto le kono coming tubabol la balu nya dorong fanan wala siata na balwo kono be domorol mini la lon ko manke fentin kamin tabis wo kono ako woto wol mu kulati fa wol mu kulati mi alon ko ka cancer nying la fa banko kan mulkan akaye wol mu to nyalati bari mim fo yatina cancer mo ka cancer soto ite wo fola no bari yalon ko kuwal bijele mini yalon ko sujute la mi yalon ko ninga tara ya mari jibe sa fa ite sa cancer soto no ko mu momi yalon ko balu tambitale balaba tiol woto ninga tara yewal jibe do resa lon no le ko seke ninga mete fanan se cancer soto no le bayri balu mu kulata manke ko kubetit bokay Dr. Shamila lim laaj Dr. Roberts moy comme cancer nakala mel comme disay bi si nit ñi o nakala getine nit ñi mom lim wax moy comme nit ñi dañoo ñëw lopitaan te dañoo duñ wax docteur yi lan a tax ñu ñëw foofu o lan lañ am o li leen gëteen foofu noonu mu ne comme duñu mën a liimal ñaata nit a am cancer waaye comme si bés bi dina mën a wax ne xëj na dina dem ba ñaari nit kiñ dee gis ki nga xam ne daf di am cancer mu ngi ko laaj mu ne ko ne comme léegi suñ dundin gi ñu ngi jël dundin tubaab yi léegi li ñoo lekk si li ñoo def lépp si lu bari loolu comme tubaab yi ni ñoo doxal seen dunda rek ñu nit noonu lañ dee doxal suñ dunda mu ngi ko laaj ndax loolu noonu am na loo xam ne dina am pour def ak dara ak cancer mu ko naan ne loolu yëpp am na solo te digala waaye comme li tax nit ñi di am cancer ba tey mënuñ koo wax waaye comme nga am yaram ba ëppa loolu tamit bokk na si loo xam ne dinañ ko mën a am jinja ne dina ku ko am rek di nga mën a am cancer comme si gàttal rek Dr. Roberts loolu la wax ñu delloo waxtaan bi Dr. Shamila.
Thank you so much, Mariama. And dear viewers, the lines will be opening shortly and the number will be appearing on the screen. While we wait for the callers to call in, Dr. Roberts, I just wanted to ask you regarding breast cancer. What are the options available for breast cancer, for women?
For when you're talking about in terms of treatment.
In terms of treatment and possibly let's start maybe from even the prevention part of it and then going onwards. It will be interesting for us all to know.
Okay. For prevention of breast cancer, like I mentioned in my introduction,
yes,
breast cancer is one of the cancers when you catch them early.
Yes.
It is fairly treatable.
Okay.
So catching it early, that is the main thing. So how do we catch it early? You catch it early by, one, encouraging people to be aware of the breast cancer and then do this what we call self breast exam. So we encourage women to be able to examine themselves when they're taking a shower. They examine their breasts, and if they notice anything different, any change, any lump, any change in the texture of the skin, anything that they notice that is abnormal, then they should go to the hospital, and then the doctor will also see them, do an examination, and then come up with a diagnosis. We've seen that a lot of women have, especially during their pregnancy, they have breast abscesses. Some is also common, but sometimes that abscess might not be an abscess. What looks like an abscess might not be an abscess. So it's good to always report to the hospital when you have these pathologies that you don't understand on your breast. So that it enhances the early detection so that we can be able to help you. And then when it comes to the options that we have for managing such, there are basically two main types of surgeries that we do. You have the breast conserving surgery and the radical type of surgery. In the breast conserving surgery we take out the lump itself, the breast cancer itself, and then you follow it up with a radiotherapy. And then the radical surgery is when you take out the whole breast. But before we get to that, you have to come up with a diagnosis. And in diagnosing that, we have to do a clinical exam. The doctor or the health personnel will examine the breast, and if they feel a lump, then there are ways in which we do what we call a biopsy to confirm whether that lump is just a benign lump or is a malignant lump. Malignant one, that's a cancer. So they take a biopsy, and there are different types of biopsies that can be taken. You can have the least invasive one is what we call a fine needle aspiration, where they use a needle and then get some cells from the breast, the tumor, the lump, and then take it to the lab for examination. And then if that is not confirmatory, then they can do what we call a core biopsy. It's a bigger needle. It takes a bigger chunk of the breast tissue, and then that again is sent to the lab for histology. Then there's also what we call excision biopsy. If you have a small lump, sometimes it's good to just take the whole lump out, and then send it to the lab for histology. But if it's very big and you cannot just take the whole thing out without being sure what it is, we do what we call an incision biopsy. We take a piece of it and then send it to the lab to confirm the diagnosis. Then we can do one of the two modalities that I mentioned.
So I think I will allow Mariama to quickly maybe summarize what you have said. I know you, some of our viewers may not understand some of the technical terms he has used, but it's basically just to see how to investigate the kind of procedures that are available. Yes.
Mbaɗigol coming nga fale ñami doron kacaɓe continue kan Dr. Robert ñinin kamin na wolom Mose.
We have a caller.
All right, no problem.
Okay, so we have our first caller. Hello, caller. Hello.
Yeah.
Hello.
Hello, Maladia.
Yes, sister.
When Baba they meet so that they meet is the that I got the sentiment.
Okay.
Wow. No, nagwari nak majahal torop.
Miti bi kan la commencé?
Miti bi ci ci bi la commencé ak ci biir.
Okay. So Dr. Robert, you heard she's complaining about pain in the breast. What is your advice for her?
Well, my advice would be to go to the breast clinic where your concerns will be addressed, and then you'll be examined by qualified personnel and then come up with a diagnosis. But one thing I must say, the most common presentation of breast cancer is actually a painless lump. It's not usually painful, although you can have painful breast cancer, but the most common presentation is a painless lump. That is why a lot of women don't come early, because you are just examining yourself and you feel a lump. It's not painful. You don't take it seriously, so you tend to forget about it. But I would advise her to go to the breast clinic. We have a breast clinic that runs every Thursday.
Every Thursday?
Yes, at the Edward Francis Small Teaching Hospital. So you can go there and then they can examine you and then help you with a diagnosis.
Before Mariama translates that, I think we have another caller. Hello, caller. Okay. Okay. So,
Wow.
Mariama, you can.
Call boobu noonu yow mi call Dr. Roberts mu ne lim la advice mooy nga dox dem si lopitaani Banjul mu ne dañ dee am breast cancer clinic every Thursday alxamis bu ne nga dox dem foofu noonu mu ne nekkut comme cancer lu baree bari su fekkee ne dafa danga koo am mu ngee jur si yaram bi mu ne daf dee nekkal loo xam ne du métti waaye waxut tamit ne comme ween bu métti du mun a nekk cancer waaye advice na la daal moom du ci gàttal demal foofu noonu docteur yi gis la ñu mun laa dimbale ni ñu la war a dimbalee.
Okay. Jërëjëf, we have another caller. Hello, caller. Hello.
Hello?
Hello.
Hello?
Hello. We can hear you.
Hello?
Nung la dega. Okay, I think we have lost that caller. Okay, so the breast clinic happens every Thursday.
Yes.
Okay.
We have a breast clinic that runs every Thursday.
Okay. Okay. I think that's a very good information for us to inform our fellow. But the other thing I was going to say fellow sisters, but then it doesn't only affect females, breast cancer.
Exactly.
Yeah. So maybe that's something else that you may also want to have.
Yes, that's one of the myths that a lot of people have.
Mm-hmm.
I remember once when I went round, we went to Keneba and Basse talking about breast cancer. And a lot of people were surprised that men can also have breast cancer. But it is possible.
Okay.
We have operated on a few men who have had
Charles,
breast cancer.
Just we have another caller. Hello, caller.
Hello?
Hello. Wow, dang la dega.
Hello?
Hello.
I'm getting you. Is it QTV?
Yes, you're on. We can hear you.
Okay. Okay, this program is very interesting.
Okay, thank you.
I'm just lucky to get through. I think I have the same problem with me, with my breast.
Okay. You're also having pain in your breast?
Yeah, I feel pain in my breast. There is no lump, but it is heavy.
Okay. So I think sister, thank you so much for that call. Just like Dr. Robert said, there is a clinic in the Edward Francis Small Teaching Hospital every Thursday. It's called the Breast Clinic. Please, this Thursday, go there and get yourself checked. That is the advice that he has given. Okay, thank you. So, Dr. Roberts, please, you can continue regarding the surgeries you said you did on some.
Yes, so we've had some men who have come with...
Okay, it seems there's another call.
Okay.
Hello, caller. Hello. Hello.
Turn down the radio.
Hello.
Yes, hello, can you hear me?
Yes, we can hear you.
Well, this is Dr. Ja.
Okay.
I could not miss this program. I'm listening to it live here in the UK. And I would like to give a big thank you to Dr. Roberts for coming and attending this program. And, this is a very important thing to talk about because cancer, as you said in the beginning, is one of the deadly diseases, and it's actually up to now, COVID has not reached it, and I don't think COVID will reach the havoc that cancer has caused in the Gambia. I just wanted to put my voice on this, in addition to Dr. Roberts' voice, that cancer is a deadly disease, but despite that, there are lots of myths in the Gambia that cancer cannot be treated in the Gambia. But I just wanted to make it clear, just like Dr. Roberts has done, that cancer is a curable disease if it is detected early, and therefore people should do everything they can to detect it early. Dr. Roberts has given some of the things that people can do to detect cancer early. And I think it's very important for women to know that, to do regular self-examination of their breasts, and also to report to the hospital anytime they see something that they don't understand on their breast. Obviously, this is breast cancer month, but there are other forms of cancer, and some of them are preventable. And maybe Dr. Shamila will highlight some of those later in the program. So I don't want to jump the gun. It's just that I wanted to be part of this program because cancer is one of the things that is ravaging the country, and I felt that I had to have my voice on it. So I thank everybody in the program for doing what they are doing. And once again, thank you to Dr. Roberts for being part of this program today.
Thank you. I think that was very, it's a good input from Dr. Jah regarding the burden of cancer in the Gambia. Thank you so much for that input. So, Dr. Roberts, we're still waiting to hear this issue, because this is a myth, just like what he also said, that men don't get breast cancer, so we don't really need to worry about breast cancer with regards to men. Can you please tell us a little bit more on that?
So for men, it's actually the breast cancer is actually more aggressive.
Wow.
Because there's not much breast tissue in men.
Yeah.
So it tends to spread faster to the chest wall and to other parts of the body. It's not as common as in women, but we do have cases of men with breast cancer, and we have operated on some in the hospital.
Okay, okay. So I think you can translate this, because it's a very important message.
Kacha kumaba adungai ku kumaba le firinjang wolam coming ni ko cancer dorong moli amero ko jama aka musol doron ne muta Dr. Roberts kami poten dorong cancer buka musol doron da surtout ni ko cancer mi sunjo min ka sunjo muta ko kel fanan ka sotala adun itolle taka jawya aka tambi musol da bari tolle sunjo ma wara adun bala jamaate je oto nin cancer e kel muta dorong aka tariale pura janjangi balu kono.
Okay, thank you, Mariama. We have a caller. Hello, caller.
Hello, assalamu alaikum.
Walaikum salam.
maa leen di nuyu.
Jërëjëf.
maa leen di gërëm di leen sant.
Jërëjëf.
di leen ñaanal waxtaan bi am na solo trop.
Jërëjëf.
waa di leen wax rek ne comme ngeen di ginnaaw waxtaan si yéen. because ñun jigéen ñi ñu bari duñ dee xam.
waaw.
yenn saa yi dara dina la dal doo xam ne loolu la ba ubba.
waaw dëgg la.
mu ñëw lor la.
waaw dëgg la.
waaye soo leen see ginnaaw waxtaan. ñu xam luñ gis ci yaram rek ñu xam.
waaw dëgg la.
su ko defee yàlla mun na see def jàmm.
dëgg la.
ba pare beneen moo leen ne ñaan mu nekk ne ngeen dee waxtaan tam ci yëppi ménopause.
ok.
because ñu bari duñ dee xam dañ dee jékki-jékki nga eggal stage boo xam ne nga gis sa yaram bi ceej yi. waaw doo xam te mu ngi sonal jigéen yu bari.
dëgg la. very important.
waaw jërëjëf
sister. Jërëjëf.
waaw
thank you very much. Thank you very much. Very important point. And what she talked about as well, the menopause part, has a lot of things to do with cancer, breast cancer, isn't it? There's a relationship. Do you want us to highlight that so that she also and women in general understand that breast cancer incidence actually increases with age, isn't it?
Yes. Yeah. Breast cancer, like many other cancers, increase with age.
With age.
And the older you are, the higher the risk,
the chance
of you getting breast cancer. And also, breast cancer is a hormone-dependent cancer. So usually, when there are fluctuations in the female hormones, then you are at a higher risk. So there are some risk factors that, like I mentioned, that put you at a higher risk for having breast cancer. And one of them is having early menarche. Early menarche is the onset of your periods. When it starts early, then you're at risk. And in that vein, late menopause also puts you at risk.
It seems we have another caller. Hello, caller. Hello.
Assalamualaikum.
Walaikum salam.
TV.
Yes.
na ngeen def.
jàmm rek.
waxtaan bi am na solo solo.
jërëjëf.
cancer da mun daf dee téye nit si baat.
waaw waaw.
hello. loolu laa doon laajte.
waaw ok dang doon laajte ndax cancer daf dee téye nit si baat. hello.
allo maa ngi laa dégg.
du loolu ngay laajte ndax nit daf dee mën a am cancer si baat bi.
waaw loolu laa laajte.
ok jërëjëf.
Okay. Like I mentioned, cancer is an abnormal growth of cells in the body that can spread to different parts of the body. And this can affect any part of the body. It can affect the skin, it can affect the bones, it can affect the blood, it can affect any tissue in the body. So you can have cancer in the throat, in the skin of the neck. You can have cancer of the esophagus, that's the pipe where the food passes. You can also have cancer of the windpipe in the neck. So there are a lot of cancers that one can have. So cancer is not restricted to just the breast. It can be, you can have cancer in any part of the body.
Okay.
Thank you.
You can translate it for us.
Mom, sa laajte boobu noonu comme niñ ko commencé rek mu ne cancer loo xam ne la comme cells yi daal niñ war a juree si biir yaram bi duñ ko dee juree noonu mu ne comme nim leen ko waxee cancer nekkut ween bi rek la dee téye mun na téye fu nekk ci yaram bi mun nga am cancer si deri baat bi mun nga am cancer si lekka bi fu mu dee jaaree mun nga am cancer sax fi ngelaw bi dee jaaree si biir yaram bi kon cancer boo ne cancer rek nekkut ne comme ween bi rek la dee mun a téye dégga dina mun a téye lu bari si yaram bi dina mun a téye baat bi mun nga am cancer si baat bi so pour gàttal rek loolu mooy sa reply bi ñu am pour yow mbaɗigol ay miññinin ka jannimɓe ko mandirla ɗo sotoro doron a ko fof moka cancer sotole min se kama muta e kama se cancer sotonole comme nga fo ñamin doron a cancer mo kurane timi alon ka manque ka sunjo doron ne muta bala jato dawoɗa doron sa sotonole ma kango sa sotonole kankuro sa sotonole hani koño ka tambe nindame na fanan sa sotonole woto cancer mo walete.
Thank you, Mariama. We have another caller. Hello, caller. Hello.
Hello.
Hello. Yes, we can hear you.
Yeah, how are you all?
We are all fine, sir.
Oh, okay. I am very much thankful to you and the program.
Thank you, sir.
Okay, I think I'll have to mute my TV.
Yes, sir. Yes.
So I just have some words of commendation about this program.
Thank you, sir.
It has been a program that I so much love and I've been following keenly.
Thank you very much.
And indeed, your invitee, that is Dr. Roberts, is someone that I highly look up to. I'm a young nurse in the field, and I'm privileged to at least have some interactions with him at ENSTH. And honestly, the deliberations here are very, very insightful and very apt. So the discussion today is very, very important, and then I must thank each and every one of you, and especially Dr. Roberts and Dr. Ija, of course, for bringing up this thing. Thank you very much.
Thank you very much to you as well. We are indeed really privileged to have Dr. Roberts here with us. Yes. So can you please, you were saying about the risk factors for having cancer. You talked about early menarche and late menopause. Yeah. And you didn't finish the discussion. I just wanted us to go back there so that we can conclude on that.
Yes. Also, pregnancy tends to give the body a relief in terms of the hormone imbalances.
Okay.
So multiple pregnancies tend to be like a safeguard towards breast cancer.
Protective.
But it doesn't mean that if you have many children, you're not going to have breast cancer.
Okay.
It's just somebody who doesn't have children is at a higher risk than somebody who has had many children. And also breastfeeding the children also sort of like is also protective in terms of breast cancer.
Okay.
So when we have also these women taking oral contraceptives for long periods, prolonged periods, that also puts you at risk of having breast cancer. And then there are some women who use this hormones after they've attained menopause. They use hormone replacement therapy. That one also puts you at risk of having breast cancer.
Okay. Thank you so much, Dr. Roberts. And I think we will stop the calls for now while we give Mariama to translate this very important message. And then after that, we will go on a short break. So let me give Mariama a chance to translate for our guest. Mariama.
Baraka, Dr. Shamila. Coming, Bekacha continue the wrong covering call mandung, Dr. Roberts Wabinko Fokam Jibir Lali, Walam. Coming ning atara momi yalonko ayala kuroje juna coming mol mini yalonko ila cancer soto se sonaya dina dolti walam ning atara momi yalonko ayala kuroje juna dorong wara momi yalonko anyanta kala kuro londi ameta akata tata fasanji jama ala kuro maluno coming na wulula al mini yalonko itata fo isanjo jampata sai kuro nyanta kalo amallo ako woto wol mol mini yalonko e baby je wol bese ke moltino le mini yalonko ise cancer soto nole ako foka pare fanang dung ning atara susu lal ako mol mini yalon ko ke dingol susundi ako wala cancer soto ako fanang at wote siala no wobe cancer soto talala nole ako foka pare fanang ko min ninga tata yela kuroje fa banta sain bayri kuro mu kulete mi yalon ko fengole be balo kono me yatine kaje kan na kuroje na sunjol ka wara ako woto ning atara wolta ta fom bululal mini yalon ko tata foila kuro lota ay ka borol ta pour mi yalon ka be mako ila ako woto o borol mini kata aka se inyatilindino ila cancer soto lale woto nyunku wal mukuleta ko fanan ning atara mol mini yalon ko mawulu e man dinjama soto wala mon dingo fango soto ako wala cancer soto wote soni ala bare ning atara dinjama soto doron ako ida cancer soto se soni anu ala bara amma foko ye dinjama jama wala ye dingol tala woto abe nyine kacha kanung mole mandi angale kan wala mboka yi comme li Dr. Roberts don wax bala ñuy dem jailbreak moy ñan la muna am cancer mu ne comme su fekkee ne jigéen dafa teel a gis fuutam mu ne ñooñu noonu dinañ mën a am comme seen yooni am cancer boobu dina mën a gaaw jigéen boo xam ne tamit teelut a dem am ménopause maanaam fuutam bi teelut a taxaw comme suñu yaay yi nga xam ne suñ demee am ay jigéen boo xam ne dafa su demee toolu yenn at fuutam bi daf di taxaw mu ne comme façon yooyu noonu sa fuut bi su teelutee taxaw tamit di nga dee mën a am cancer comme jigéen yoo xam ne tamit musuñoo am doom ñooñu tamit pour ñu am cancer dafa gaaw waaye comme su fekkee ne da ngay nampal tamit pour nga am cancer boobu dafa wàññeeku tamit su fekkee ne comme jur nga ay doom boobu tamit dina wàññi sa opportunity pour nga am cancer comme si gàttal loolu la doon wax ma delloo waxtaan bi Dr. Shamila balaa ñuy jël break bi.
Thank you very much. Thank you so much, Dr. Roberts, for joining us today. And we hope to see you again another time on this show. Thank you so much for your input. So dear viewers, we will go on a short break and we'll be back shortly with another guest. Thank you.
Right time, right place, right price. Promote your product, business and brand to millions of viewers nationwide or across the globe. Call QTV Marketing on 32-44444 or email us at marketing@qtv.gm for all your advertisement needs. QTV Gambia, right place. At QCell's e-Fankanta service, amulo dara lingay halat ci ñaka credit. Su fekke amulo xaalis ci sa loxo wala nga sori jaaykati credit. QCell's e-Fankanta mooy lu wóor. Lebal loo bëgga ci diggante $10 ak $100 nga fay waxtu boo bëggee tegal star 393#. QCell di def suñ kemtalay kàttan pour di nekk. Right time, right place, right price. Promote your product, business and brand to millions of viewers nationwide or across the globe. Call QTV Marketing on 32-44444 or email us at marketing@qtv.gm for all your advertisement needs. QTV Gambia, right place.
COVID-19 is an infectious disease caused by a new coronavirus introduced to humans for the first time. It is spread from person to person, mainly through the droplets produced when an infected person speaks, coughs, or sneezes. These droplets can land in the mouths or noses of people who are nearby. These droplets are too heavy to travel far in the air. They only travel approximately 1 meter and quickly settle on surfaces. This is the reason person-to-person spread is happening mainly between close contacts. The exact time that the virus can survive on surfaces is not yet known. So it is wise to clean surfaces regularly, particularly in the vicinity of people infected with COVID-19. Hands touch many surfaces, which can be contaminated with the virus. You should therefore avoid touching your eyes, nose, or mouth, since contaminated hands can transfer the virus from the surface to yourself. When coughing or sneezing, cover your mouth and nose with the bend of your elbow or use a disposable tissue. If a tissue is used, discard it immediately into a closed bin. The most effective way to prevent the spread of the new coronavirus is to clean your hands frequently with an alcohol-based hand rub or soap and water. This will eliminate the virus if it is on your hands. Stay healthy and prevent the spread of COVID-19.
Welcome back, dear viewers. We have been talking about cancer, and in particular breast cancer, with Dr. Charles Roberts. And now in the studio we have another guest who is going to talk about one of the most important part of cancer, which is the raising awareness. So let me introduce our guest. Her name is Mariama Jallow. And she is the reigning beauty queen. She will tell us more about that. And she's also the founder of Smile Gambia Foundation. Mariama, you're welcome to the show.
Thank you so much.
Can you please tell us a little bit more about yourself?
Officially, like you said, I'm Mariama Jallow, but society will call me Bobo. Okay. I'm a student nurse and a radio presenter and a beauty queen as well. 12 times crown holder in the pageant industry. This crown here is the Miss Smiling Coast International Beauty Pageant. And this year I won the Miss Fube Gambia International All Stars 2020.
Wow. Congratulations.
Thank you.
So can you tell us more about Smile Gambia Foundation?
Yeah, thank you so much. Smile Gambia Foundation is a charitable organization geared towards restoring smiles, promoting health, impacting lives, changing community, and basically putting a smile on each and everybody's face out there, and to end bullying and isolation as well.
Okay. Thank you very much. That's a very, very good cause that you have there in that foundation, and we are very pleased to have you. Mariama, maybe you can introduce her to our viewers.
Assalamu alaikum ala baraka koteke na murunta na nyimbrik sutungo kabra batala na luntam fulanjango e kafole Mariama Jallow. Mariama Jallow dung coming mol minili alon ko kila nyinya itandi do ko jata kende abunda karola akate mu no solati abe karangola puruka ke no soti adum fanang alkaje ko ay nyin crown o min sota ko ngototeng ko sinyatang aning fula ay crown o win adum foka pari fananga ay organization wala kafo soto fanay kafo mi Smile Gambia Foundation wala puru mol minili alon ko ka ke kontandi kaje ko mol kana ni ko ya soto fanang banko kan ako ala foundation o nyatilinta wala woto na lunta mbam walati Mariama Jallow mbokay comme ni ngeen ko gisee rek ñëwati nañ after break bi waxon nañ leen amon nañ ñaareli gan ñaa gan ba nak ñu ko wax Mariama Jallow. Mariama Jallow daal Miss beauty queen la beauty queen boo xam ne moom win na crown bi 12 times maanaam fukk ak ñaari yoon win na ko ba pare tamit create na foundation boo xam ne ñu ngi ko wax Smile Gambia Foundation maanaam pour jëfoo doomi réew mi nga gis ñi nga xam ne seen xol yi béguñ ñu isi kontante si seen àdduna gi ak seen dunda bi tamit mu ne loolu lañ nekk di liggéey moom nag mu ngaa jànga tamit mu ngaa def beauty queen competitions mu ngi ko attend waaye terewut ko tamit mu ngaa jànga mu ngi jànga nursing kon loolu lu am solo la si carrière bi. Dr.
Thank you very much, Mariama, and you are really doing a good cause there. Can you please tell us what you are intending to do for the breast awareness this month?
Yeah,
breast cancer awareness.
Awareness, yeah. This year, October, of course, we all know October is the Breast Cancer Awareness Month.
Indeed.
And the Smile Gambia Foundation decided to partner with the C3G, a non-governmental organization formed by doctors and entrepreneurs. You know, the likes of Mr. Job and the likes of Layla, of Malak Chemist, the likes of the Director of Health Services as well. We decided to partner with the C3G because personally I had the opportunity to attend the breast cancer awareness that they had sometime in 2018. It was when I learned how to do, like, to self-examine myself.
Yes, indeed.
Yeah, which was very important. And you know, we deemed it necessary. Okay, like a whole lot of girls out there kind of think breast cancer cannot happen to them for one or two reasons. Probably they don't keep phones in their bras, or they don't keep money in their bras. That is the mindset that each and every person out there has. And we kind of want to change that mindset and increase awareness on breast cancer. So we decided to partner with the C3G since they've been raising the awareness over the past 3 years, organizing events and doing free screening for all the women, which is a good cause. And it's a great pleasure for the Smile Gambia to also partner with them and also collaborate with all the beauty queens in the industry as well, because we all have similar platforms, though they are not the same. And it all boils down to women, girls, and children.
Fantastic. Fantastic. So what exactly are you planning to do with C3G? What activities, so that we can inform our viewers?
Yeah, the activities we'll be doing with C3G on that day, we'll have a breast cancer awareness walk. From
when is that?
October 24th.
October 24th.
That is this Saturday
this
coming.
Saturday?
Yeah.
Okay.
We're going to have a breast cancer awareness walk, which is going to start from the QCell house all over
from
to
here, from this building. Okay.
Yeah, all over to the Westfield Monument, where we'll have a session on learn more about breast cancer. Of course, we'll have entertainment to spice it up. Then we'll have free screening for each and every woman and girls that are on board.
That will be at the Westfield Monument.
Exactly.
And what time will the walk start from here?
The walk is going to start exactly by 10 a.m.
10 a.m. from here?
Sharp, yeah.
Okay.
There's nothing like Gambian time, so we're going to start by 10 a.m. and the event is expected to end by 3 p.m.
Okay. So, and then the walk to the... Okay, fantastic. Mariam, I think you can translate this very important message for all our women out there to come.
Badingol coming afale nyamin na luntamba ya nyininka itolbe mundo kul la Smile Gambia foundation ibe mundo kul la puruka nying cancer me alon ka sunjo muta coming itolning kafomi yalon ke kafo C3G nga jeko nene ye kumandi nunjani itol fanang itolni wolle kafuta nyola puruka jeko ye mol mako ye musol mako ke karandi ka yitandi mol la fanang coming munam cancer ti adun ni ko cancer mi ga sunjo muta ibitala no nyaade le ke fama ko ako mo jamal comme surtout son kutu ndingol imal la ko comme cancer ne so tol mutano la bayri ya sake ne man ko do bulela boday sol kono wara man telephone ol bulela boday so kono ako wala tinna italia je ko ninni C3G nyanta ka funyolale pour ka banko dingol fanan karandi surtout son kutu ndingol ani musol ani kel fanan comme nga fanyami nga buka musol ni son kutu ndingol do muta kel fanan ka sotale pour ke karandi ka foy ko munam breast cancer ti akoy ba tamo kelale 24th October wala mnyen sebiti lungo ka kumasi QCell building oto jang bungo to jang talantang mi lafta molbe taraje talanta ye taraje saje se tamam for Westfield monument to mimbije ning atare fotata woto tamata foy fotata woto dorong ibe mol fanan karandela le ka mol la londo la fa ning atare ko kansa min ka sunjo muta muno mate adum fana ibe mol fanan kiskisiro kala mol le wala screening nyinti wota kuma ya batale pour mol ye wuli ye kafuy kan kanyul lungo jurandi saje se min nyini noje do raysa wosoto noje mbokay comme ni ma ko don waxe ci soose rek suñ gan bi Mariama Diallo lim don wax liñ ko laaj moy mom Smile Gambia Foundation bi lan lañ nekk di def ci yefi breast cancer bi lim ñu wax moy ñom dañ join foundation bo xamne ñu ko wax C3G dañ leen join pour at bi ñu mëna jangal nit ñi lan moy cancer ak cancer buñ waxe budé téé wén bi rek naka la di téé nit ki mu ne comme que amna jangha yo xamne olu nañ ne ñom dañ gom ne duñ musa am am cancer xëy na liñ gom mooy maanaam musu ñoo dugal téléphone bi si seen bodaay si musu ñoo dugal xaalis si seen bodaay si comme façon yooyu nag dafa am solo trop pour jànxay xam jigéen yi xam ne loolu nekkul su fekkee ne da nga koo def mënuloo am cancer léegi mu ne comme ñoom ak C3G dañoo am def dox boo xam ne fii lañ ko commencé QCell building maanaam 10 o'clock Saturday mooy 24th of October dinañ doxantu ba Westfield Monument bi te buñ fa eggee tamit dinañ am waxtaan boo xam ne dinañ ko am ak ñi fa nekk si lan mooy cancer ak mbirum cancer ak naka la nit mën a dimbalee boppam te dinañ dem ay lab investigation screening maanaam dinañ screen nit ñi tamit foofu noonu ñu mën a xam naka la seen yaram bi mel ndax am nañ cancer ndax amuñ cancer so si gàttal ñoom loolu lañ dee def te loolu la ñoo lifin ñu ngi ñaan askan Gambien yi nañ leen join pour ñu mun a xeex lii breast cancer si dëkk bi.
Thank you very much, Mariama. So at the end of the program, but I'm sure you're going to make sure that the COVID-19,
yes,
what everyone needs to do is going to be followed.
Yeah.
So dear viewers, we have come to the end of the program. We discussed about cancer and breast cancer and what are the things that are available in terms of prevention and treatment for breast cancer in the country. And then we also talked to you about the walk that is happening on Saturday and free breast screening that will be happening on 24th. Please remember 24th October, this Saturday, 10 a.m. starting from this building. So dear viewers, on that note, we will see you next week, and goodbye. Stay safe.